The NP aims to deploy a new technique in the provision of patient care, cognizant that the main obstacles to change are typically A. Lack of adequate preparation. B. Poor change design. C. Insufficient supporting data. D. Staff resistance. A 12-year-old boy cracked ribs 7 and 8 on the left side in a bicycle motor vehicle collision. The sight of these injuries raises the possibility of A. Renal trauma. B. Tracheal or bronchial injury. C. Pneumothorax or hemothorax. D. Hepatic trauma. The family nurse practitioner asks a patient to perform rapid, alternating movements of the hands to evaluate A. Cerebellar functioning. B. Cognitive functioning. C. Reflex arc functioning. D. Stereognostic functioning. A difficult aspect of determining occupational exposure to disease is the A. Confidentiality of the information within company records. B. Inaccuracy of occupational disease reporting. C. Long latency period between exposure and disease development. D. Reliance on workers' memories. A 42-year-old patient with epistaxis, dilated pupils, tachycardia, and mild euphoria shows symptoms associated with the use of A. Alprazolam. B. Cocaine. C. Morphine sulfate. D. Oxycodone hydrochloride. During cardiac auscultation, a soft first heart sound with a holosystolic apical murmur that radiates to the left axilla suggests A. Aortic stenosis. B. Mitral regurgitation. C. Mitral stenosis. D. Mitral valve prolapse. Clinical practice guidelines are designed to A. Increase variations in clinical care. B. Mandate practice decisions. C. Protect nurses from legal liability. D. Serve as a handbook for best practice. Which drug is associated with increased lipoprotein levels? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Triamterene. Treatment of viral conjunctivitis includes the use of A. Antihistamine decongestant drops. B. Cold compresses. C. Hot compresses. D. Steroid eye drops. What is the main reason for administering a progestational medication to perimenopausal women who use estrogen? A. Decrease the risk of endometrial hyperplasia. B. Prevent hot flashes. C. Prevent osteoporosis. D. Promote growth of the uterine lining. The family nurse practitioner advises a nursing mother who has postpartum mastitis to take antibiotics as prescribed and A. Continue to nurse with both breasts. B. Pump the unaffected breast with a lactation pump. C. Take cool showers. D. Temporarily switch to formal. Which health promotion strategy is most appropriate for adolescent patients who are obese? A. Individual-based behavior modification. B. Motivational interviewing. C. Parental regulation of meals. D. Presentation of video case studies. During a physical examination, the integrity of the facial nerve can be assessed by having the patient A. Clench their teeth. B. Extrude their tongue. C. Produce a big yawn. D. Puff out both cheeks. After determining that a 2.5-year-old patient has a lead level of 16 micrograms DL, the family nurse practitioner A. Advises the parent to avoid giving the patient bottles of whole milk. B. Consults with a physical therapist for muscle strengthening. C. Repeats a blood test within 1 week to 1 month. Which action by the nurse in charge is essential when cleaning the area around a Jackson-Pratt wound drain? A. Cleaning from the center outward in a circular motion. B. Removing the drain before cleaning the skin. C. Cleaning briskly around the site with alcohol. D. Wearing sterile gloves and a mask. Vivid dreaming occurs in which stage of sleep? A. Stage I non-REM. B. Rapid eye movement stage. C. Stage 2 non-REM. D. Delta stage. The natural sedative in meat and milk products that can help induce sleep is A. Flurazepam. B. Temazepam. C. Methotrexate. D. Tryptophan. Nursing interventions that can help the patient to relax and sleep restfully include all of the following except A. Have the patient take a 30 to 60-minute nap in the afternoon. B. Turn on the television in the patient's room. C. Provide quiet music and interesting reading material. D. Massage the patient's back with long strokes. Kubler-Ross's 5 successive stages of death and dying are A. Anger, bargaining, denial, depression, acceptance. B. Denial, anger, depression, bargaining, acceptance. C. Denial, anger, bargaining, depression, acceptance. D. Bargaining, denial, anger, depression, acceptance. A female patient undergoes a total abdominal hysterectomy. When assessing the patient 10 hours later, the nurse identifies which finding as an early sign of shock. A. Restlessness. B. Pale, warm, dry skin. C. Heart rate of 110 beats minute. D. Urine output of 30 milliliters hour. Which of the following symptoms is the best indicator of imminent death? A. A weak, slow pulse. B. Increased muscle tone. C. Fixed, dilated pupils. D. Slow, shallow respirations. A nurse caring for a patient with an infectious disease who requires isolation should refer to guidelines published by the A. National League for Nursing. B. Centers for Disease Control. C. American Medical Association. D. American Nurses Association. To institute appropriate isolation precautions, the nurse must first know the A. Organism's mode of transmission. B. Organism's gram-staining characteristics. C. Organism's susceptibility to antibiotics. D. Patient's susceptibility to the organism. An autoclave is used to sterilize hospital supplies because A. More articles can be sterilized at a time. B. Steam causes less damage to the materials. C. A lower temperature can be obtained. D. Pressurized steam penetrates the supplies better. After having an IV line in place for 72 hours, a patient complains of tenderness, burning, and swelling. Assessment of the IV site reveals that it is warm and erythematous. This usually indicates A. Infection. B. Infiltration. C. Phlebitis. To ensure homogenization when diluting powdered medication in a vial, the nurse should A. Shake the vial vigorously. B. Roll the vial gently between the palms. C. Invert the vial and let it stand for 1 minute. D. Do nothing after adding the solution to the vial. A patient must receive 50 units of Humulin regular insulin. The label reads 100 units equals 1 milliliter. How many milliliters should the nurse administer? A. 0.5 milliliters. B. 0.75 milliliters. C. 1 milliliter. D. 2 milliliters. How should the nurse prepare an injection for a patient who takes both regular and NPH insulin? A. Draw up the NPH insulin, then the regular insulin, in the same syringe. B. Draw up the regular insulin, then the NPH insulin, in the same syringe. C. Use 2 separate syringes. A patient has just received 30 milligrams of codeine by mouth for pain. 5 minutes later he vomits. What should the nurse do first? A. Call the physician. B. Remedicate the patient. C. Observe the emesis. D. Explain to the patient that she can do nothing to help him. A patient is catheterized with a number 16 indwelling urinary catheter to determine if A. Trauma has occurred. B. His 24-hour output is adequate. C. He has a urinary tract infection. D. Residual urine remains in the bladder after voiding. Nurse Clarice is teaching a patient about a newly prescribed drug. What could cause a geriatric patient to have difficulty retaining knowledge about prescribed medications? A. Decreased plasma drug levels. B. Sensory deficits. C. Lack of family support. D. History of Tourette syndrome. When examining a patient with abdominal pain, the nurse in charge should assess A. Any quadrant first. B. The symptomatic quadrant first. C. The symptomatic quadrant last. D. The symptomatic quadrant either second or third. The nurse is assessing a postoperative adult patient. Which of the following should the nurse document as subjective data? A. Vital signs. B. Laboratory test result. C. Patient's description of pain. D. Electrocardiographic waveforms. A male patient has a soft wrist safety device. Which assessment finding should the nurse consider abnormal? A. A palpable radial pulse. B. A palpable ulnar pulse. C. Cool, pale fingers. D. Pink nail beds. Which of the following planes divides the body longitudinally into anterior and posterior regions? A. Frontal plane. B. Sagittal plane. C. Mid-sagittal plane. D. Transverse plane. A female patient with a terminal illness is in denial. Indicators of denial include A. Shock dismay. B. Numbness. C. Stoicism. D. Preparatory grief. The nurse in charge is transferring a patient from the bed to a chair. Which action does the nurse take during this patient transfer? A. Position the head of the bed flat. B. Helps the patient dangle the legs. C. Stands behind the patient. D. Place the chair facing away from the bed. A female patient is being discharged after cataract surgery. After providing medication teaching, the nurse asks the patient to repeat the instructions. The nurse is performing which professional role? A. Manager. B. Educator. C. Caregiver. A female patient exhibits signs of heightened anxiety. Which response by the nurse is most likely to reduce the patient's anxiety? A. Everything will be fine. Don't worry. B. Read this manual and then ask me any questions you may have. C. Let's talk about what's bothering you. A scrub nurse in the operating room has which responsibility? A. Positioning the patient. B. Assisting with gowning and gloving. C. Handling surgical instruments to the surgeon. D. Applying surgical drapes. The nurse in charge measures a patient's temperature at 102 degrees Fahrenheit. What is the equivalent centigrade temperature? A. 39 degrees Celsius. B. 47 degrees Celsius. C. 38.9 degrees Celsius. D. 40.1 degrees Celsius. To evaluate a patient for hypoxia, the physician is most likely to order which laboratory test? A. Red blood cell count. B. Sputum culture. C. Total hemoglobin. D. Arterial blood gas analysis. The nurse uses a stethoscope to auscultate a male patient's chest. Which statement about a stethoscope with a bell and diaphragm is true? A. The bell detects high-pitched sounds best. B. The diaphragm detects high-pitched sounds best. C. The bell detects thrills best. Which human element considered by the nurse in charge during assessment can affect drug administration? A. The patient's ability to recover. B. The patient's occupational hazards. C. The patient's socioeconomic status. D. The patient's cognitive abilities. An employer establishes a physical exercise area in the workplace and encourages all employees to use it. This is an example of which level of health promotion? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. What does the nurse in charge do when making a surgical bed? A. Leaves the bed in the high position when finished. B. Place the pillow at the head of the bed. C. Rolls the patient to the far side of the bed. D. Tucks the top sheet and blanket under the bottom of the bed.